all is definitely not well with medical consultancy in our country. The Medical and Dental Consultants Association of Nigeria, MDCAN, has sounded this spine-chilling alarm. It says that 9 out of 10 medical and dental consultants with less than 5 years of experience plan to leave the country for greener pastures. President of the association, Dr. Victor Makonjola, disclosed this during a survey carried out in March. He revealed that some 500 medical and dental consultants had fled Nigeria for developed countries. Yes, we are in a quandary, but Wale, is the grass greener on the other side? Always.
There are so many reasons why medical doctors, leave the country. And we are not just talking of medical doctors, we are talking of health workers.
Yeah.
And I think if you look at the history of Nigeria in the 70s, in the 60s, it wasn't like this. But from the 80s, we have seen a geometric increase in the number of Nigerians, medical officials who want to leave the country. First, they have to leave because the conditions of employment in those countries are far better than what they get here. Then the dignity associated with the profession in those countries is far better than what they get here. Then exposure to modern equipment, facilities, journals.
So the tools you work with are there?
The tools are there. So I think this is going to have a very terrible impact on our health sector. Not now, we are going to feel it now, but it's going to be more in the future because these are the people that are supposed to train our medical doctors. We have 24,000 doctors in Nigeria, from what we have told. That's a ratio of about 1 doctor to 8,000 people.
Patients.
Whereas the UN recommends 1 doctor to 600 patients. And even when we are talking about the ratio, maybe we are talking about urban areas. If you go to rural areas in Nigeria, probably you are talking about 1 to about 15,000, where there are no even medical doctors at all.
In some areas, yeah.
So I think it's an emergency in the health sector. And I believe that there are a lot of things government can do to stop this drainage. It's a critical sector of the economy. Because if there is people don't have access to good health, it will affect productivity. It will affect, the living standards of the people. It will affect the number of years people can stay on life. This life. So I think the government should see this as an emergency, and I believe there are steps they can take to ensure that medical doctors are encouraged to stay back after the training.
Yeah. And Jide, largely, these things are preventable. Largely preventable.
Yes, but first and foremost, economic migration is usually the product of a country's economic outlook. If people can see that the economy is doing well, if the currency is stable and strong, many people won't feel the need to emigrate. Economic migration is not new and it's not something bad in a sense, in itself. But the rate at which medical personnel are leaving our country leaves so much to be desired. It shows that we have not prioritized the health sector. We are not doing what we should do in the health sector. Some of them are not simply leaving because of the money, but because the tools to work with,
are not there.
The next generation tools to work with are not there. I can tell you that if you have an hospital and you equip it with top-of-the-range equipment, it will be a pride to medical doctors to work there. They will be very happy.
They can't wait to resume.
Yes, knowing that some of the things there are some of the best in the world. They want to test their hands on the best equipment. But what we have is a situation in which the hospitals have been left unattended, public hospitals left unattended for so long. Even our leaders, when they are ill, They don't want to go to those public hospitals. They are thinking of first of a private hospital, maybe in Lekki. During COVID, you saw a lot of them were taken to one hospital in Lekki. It didn't stop them from dying there, though. Now, if they don't stop there because of travel hitches, as we experienced during COVID, they are thinking of going abroad. Some of them go to Egypt. Egypt, that ordinarily Nigeria should be ahead of it. You know, at independence, we were not Egypt's mate.
India,
Malaysia, they are sending, not to talk of Dubai and the rest.
Yeah.
I know somebody who had an accident recently, one of the northern states, straight Dubai. We don't, our hospitals are not equipped to handle some cases that you don't even have to travel abroad for. Now, to compound matters, you are also not remunerating these medical personnel sufficiently. So
that's it.
every man is by nature ambitious. You want the best for yourself and for your family. So they will want to live. If our people, even during COVID, when they were not hiring in the UK, Nigerians that went abroad were still went to UK, were still in excess of 700 Nigerian doctors. So wow. I'm waiting anxiously for the figure for this year. By the time that of this year is released, because it's been going up from 2015. In fact, in some cases, you see the figure for a year will double that of the previous year. That's how bad this thing has become. So a doctor was telling me that his biggest concern is that at medical school, they're already discussing how to live. They are not waiting to practice anymore. They are already at medical school. They are in school. Oh. They are already thinking of living.
They are thinking of a grass that's greener.
Yeah, they want to japa. Now, you know the implication of that. We need to freshen up the senior cadre. The rate at which we are going, we will find a kind of discombobulation between the higher cadre of medical personnel and the junior.
Yeah.
Because you will now find that there are far more of those ogas, senior people available than the juniors. And there's no way those ones can function alone. Yeah. They need those guys to work hand in hand with them. So this is a situation that we will find ourselves. Even whether we are talking about nurses or midwives or dental surgeons, pharmacists, they are all leaving. More than 6,000 pharmacists left in less than 10 years. Wow. So it's just, there was something also that I saw that bothered me. So as I said, in 2015, 279 moved to the UK. By 2017, 475.
Oh, yeah.
Look, you see the way it's going up. In 2018, 852 moved to the UK. By the following year, 2019, 1,347. So it's really alarming the way it's going. 2020, they were not even hiring because of COVID. Yet, 833 left.
Wow.
So now, for this year, for 2021, 932. I can tell you that if this trend is anything to go by, 2022, by the time the figures for 2022 are out, we will be dazed. And it's going on like that. A doctor friend of mine sent me a message after watching us last week talking about this problem. And he said, as he was talking, it felt like somebody preaching and hopeful that this problem will come to an end. You know what was his last two lines? He said, as I'm talking to you now, I've made up my mind to leave.
Wow.
It was a tough decision for me to take, but I do not have a choice. That's somebody who had done clinical practice for 10 years. He had reached the peak of clinical practice. So instead of staying here and see what further progress he could make, he too had decided to leave.
Yeah.
So it's a terrible situation. If it goes on like this, Honestly, we will not have enough medical personnel
Left for
our
the
public health
teeming
institutions.
millions.
Yes, because
Well, you know, they say memory is very unkind to an old man.
Yeah.
Just to recall that the UCH, this same UCH at Ibadan, used to be a reference point in the Commonwealth of yore, you know. So how we dropped the ball, I can't understand.
Well, it's very simple. The health sector cannot be isolated from the political economy and the character of leadership. It cannot be isolated from it. So from the 80s, we have seen decline, you know, the quality of leadership at the national and the state level. So the way our resources are managed, the vision of those that lead us, their perception about what is good and what is bad. So when you have a country where, you know, people in power think mostly for themselves, they don't take their health care here. Anytime they are ill, they go abroad. How do you expect such people to invest in the health sector when those health sectors do not actually meet their needs? So, you know, the situation we are talking about medical doctors living. The fact also is that best students in secondary schools, the next thing is that they want to go abroad.
Oh, yeah.
Medical doctors, you know, if you want to do medicine, you want to go and do it in Canada. We are not talking even about those that have been trained here, but potential young men, the best in engineering, the best in computer science, from the best secondary schools all over the country. The target is to go abroad. They want to go to Harvard. And even we are talking abroad, not just Europe alone. Some want to go to Ghana. They prefer to go and study in Ghana. I have a cousin who is a medical doctor. He moved to Lesotho. And he told me, look, in Lesotho that, you know, it's peaceful, you know, better remuneration, the working conditions, they don't take the light, it's more comfortable, his family are schooling, you know, there's no kind of trauma when he shouldn't go to school. So even the social and cultural environment.
Wale, but do you know, even at that level, you know, a little something dies in you. You know, I could have been doing this in my country.
Oh, sure.
You know.
That is it. But you see, they have a kind of passion for the country.
Yeah.
They always cry about, oh, I wish my country is better.
Oh.
But nobody is listening to us.
All right. So we hope that our best days are not over. But I hear Nigerian doctors are some of the best on the planet.
Sure, all over the world. Wherever they go, in Europe, everywhere, they are the best. Even here, they still come and take some of them to go abroad when there are special cases to be dealt with.